Doctors of Reddit. What was the worst thing you've seen for a patient that another doctor overlooked? Broken neck. No really. So this one guy was brought in with an ambulance for upper airway obstruction. We diagnosed what looked like an advanced throat cancer and did a tracheostomy. After the operation, where you pull and push the neck like crazy, we checked his neck x-ray and a junior asks when did he break his neck. He had a brand new unstable neck fracture. Checking his initial x-ray we see that it was there prior to the operation. After questioning the patient he said that on his way to the hospital the ambulance was in a car crash. No one bothered mentioning it to us when he eventually came in. He only thought he had some whiplash, but he was a few millimeters away from permanent paraplegia. Unfortunately he passed away about 2 weeks later due to the cancer. Man, that's so wild. This thread is so hard to read. It's freaking scary getting told, we're not sure, but don't expect good news. I had pretty constant stomach pain last year. I'm pretty fit, active, eat fairly healthy, 26, so you know. The doctor said it was probably nothing, and gave me some acid reflux meds, which confused me because it was very much a lower abdomen pain. I was in and out of the hospital with this constant pain. Man, it was bringing me down. I'm usually super chipper and a happy-go-lucky kind of guy, and when I started feeling not myself, I knew it wasn't nothing. So they did a ton of blood tests and such and still didn't have an answer. I would wake up, after barely sleeping, and say, I'll have a single piece of toast, I've been eating toast my whole life, it's not that. And just feel like shit all day. Terrible, terrible stomach pain. I remember just weeping at one point just in a total loss. Like they keep saying, nothing's wrong, we can't tell, your blood is fine. So, my doctor suggested I have a colonoscopy just to make sure it wasn't ass cancer or something, and as they were putting me under for the procedure, the attending doctor said, hey, I noticed something on your blood work, we're going to take a biopsy of your upper intestine as well, but we'll have to go through your mouth. I was lights out as he said that. So they dental flossed me down the throat and up the back door, so to speak. 3 weeks later, it turns out I have celiac disease. After drinking beer and eating bread my whole life, it just kicked on like that one day. Glad that doc took the endo biopsy because it wasn't showing up on the blood work. My pipes and blood were just fine, but I was severely scarred from celiacs in the upper intestine and didn't even know it. It was starting to block proper nutrients from getting absorbed, so if I didn't get that I would have presented to the a few weeks later with scurvy. Wild stuff, and honestly, best case scenario, because my treatment is just, don't eat wheat. I have to admit, already being lactose intolerant that was kind of shirty, to hear, but hey, what can you do? Could have been much worse, but not fun to go through during COVID times and alone. TLDR. As I was fading from surgery drugs before a colonoscopy and a doc added an extra step to the procedure and figured it out. Edit. Thanks for all the kind words. As I said, I'm doing 100% better. I'm not a doctor, so I'm not recommending anything, but if you're having stomach issues, get your pipes checked out. There's a lot that can go wrong in there. Patient was lactating but not pregnant or breastfeeding. Previous doctor told her it was residual from her baby that had been weaned for 14 months. Sent her immediately for a brain scan, brain tumor. She had surgery a week later to remove it and is doing very well now. Edit. Wow, I didn't think anyone would even read this or I would have explained better, tried to sound a bit more professional. I did not do any of the follow-up care. She left my office with a referral for an MRI and a referral to an endocrinologist, who took over care. Also, please, if you are concerned about your health in any way or are not happy with your doctor, care, obtain your medical records and bring them with you to a different doctor. Don't solicit medical advice from strangers on the internet that know nothing at all about your medical history. That is very dangerous to your health. This happened to me. My daughter was 5 years old and I was still lactating. My doctors didn't listen and told me my husband was playing with my breast too much. I went to my cousin, who is a OB/GYN, and she spoke with my doctor and he ran some test. Turns out I have a Rathke's cleft pouch on my pituitary gland. It was drained and came back. Due to other doctors not listening to me, it took another 8 years for them to find out I have Addison's disease. By then I shocked everyone that I was even alive. Edit. Hi everyone. Wow, I never expected this to go anywhere. My journey started in the early 90s and I am still getting diagnosis. There are wonderful doctors in this world, especially in America, although our medical system is terrible, and my story is one of many that proves how hard it is to be heard in this world while being a woman. I was young then and as I got older my voice has gotten much stronger. My conversations with my doctors go a lot differently. Thank you guys for the awards and great conversation. I appreciate you all. Edit 2. If any of you have medical questions, call your doctors. I am not a drive. I'm just a regular person that's been through some stuff. My husband had a weird dimpled spot on his back. Went to the dermatologist multiple times, was brushed off and told not to worry about it. Derm even burned off a nodule that was bothering him, at his belt line, but repeatedly said it was nothing and was visibly irritated with us for being anxious. We waited for nearly 10 years before going to another dermatologist, since our experience was so negative. Next, derm immediately diagnosed what turned out to be a sarcoma which had 10 extra years to grow. My husband now has a 48-inch scar snaking down his back from the removal of the tumor and the reshaping of his back. I now have months of experience with wound drains, tunneling, bandages, triage and the laundry that comes with massive wound healing. I would like to take that first dermatologist who was so fucking patronizing with our concerns and shove his face deeply into his own ass. My friend's sister had a very similar experience. 10 years of asking about it and no doctor took her seriously until she was pregnant. She died 2 years later. Edited a typo. Going to take this opportunity to say you are never too young to have cancer. Everyone waved her off saying, "You're too young, it's just a mole." If you think something is off, pester your doctor until you get the attention and tests you need and deserve. I suppose I have one for this as a resident doctor. We saw a kid in the eMERG for difficulty walking. He had been slowly losing the ability to walk over months, and also had random unexplained projectile vomiting episodes. Looking at his records, he saw his doctor several times who x-rayed one hip. Then the other hip. Gave some Zofran etc. Turns out on exam he is blatantly ataxic, bad coordination, and can't even stand. Failed all our bedside neurological examinations for cerebellum function. It was obvious to me and I'm not even good at this yet. Did a CT scan. Big ass tumor in his cerebellum. It was obstructing fluid drainage in his brain too, raising his intracranial pressure and causing the vomiting. Had to call in the neurosurgeons overnight for emergency drain and he went to ICU. Later had more surgery for the tumor. My supervisor got pretty emotional about it actually. Edit. Thanks everyone. The history was that he really declined further over the last few days prompting the ed visit, so he looked really bad for us but I'm not sure what he looked like before. To any med students reading this, 1. Do an exam. 2. It's okay to cry sometimes. Jesus, that's horrible. Was he okay, do you know? I found an obvious huge rectal cancer on a patient who was previously told over and over again that she had hemorrhoids. I run into this a lot as a surgeon. Very few primary care providers will do a rectal exam. Just tell the patient that rectal bleeding probably hemorrhoids and give them ointment. If it doesn't resolve within a few months, I get the referral for hemorrhoid surgery and find the rectal mass. Either that, or find a colon cancer on the colonoscopy that they should have ordered months ago. My best friend was in her late 20s and was feeling constant irritation in her stomach. She went to see several doctors over the course of almost 3 years, and they all dismissed her saying she had an irritable bowel. She would try a new diet every few months, but nothing helped. One day she calls me and tells me she broke her ribs. She didn't know how it happened, but she started having horrible pain and her doctor said her ribs must be fractured. Long story short, it wasn't fractured ribs. At some point when the pain became too much to bear, she went to the ER and got a quart. Turns out she had stage 4 colon cancer with 4 inches tumors in her abdomen that were compressing her organs and causing the pain. She died a few months later. She'd been seeing doctors about her symptoms for 3 years. If one of them had taken her seriously and sent her to get a colonoscopy, she'd probably still be alive. Edit. Wow, thank you everyone for the kind words and awards. It's disturbing, but sadly not surprising, to see there are so many similar stories to this. If you feel like something is off with your body, trust your instincts and don't listen to doctors who try to tell you otherwise. For the record, this was not in the US. I don't want to say where I'm from to protect my friend's identity. Small country, and she has a sibling who used to be on Reddit. Any doctor could have sent my friend to a colonoscopy, but I guess it was easier to write her off. The cancer may have killed her, but the reason for her death was apathy. I work in EMS. We got a call for a female with leg pain. When we arrive on scene, this woman's leg is 3 times the size of her other one, blue and purple, and she has no pulse in her foot. She fell on ice a few days prior and the urgent care didn't do any x-rays, told her she had a sprain and gave her a walking boot. In reality, her tibia and fibula were both so badly fractured they were cutting the blood vessels and muscle tissue. She lost her foot. Holy shit. Losing a foot is a serious consequence to something so normal. I don't understand why they wouldn't do an x-ray. Of all these stories, this one is the strangest to me. Why would you give someone a moon boot and not x-ray? Are all these stories sheer incompetence, or are hospitals in America for profit, won't do things deliberately to save money? MD here. Recently was called over by a nurse who told me a patient's bandages were wet as they were bleeding a little. Patient had recently had his leg amputated. We pulled his bandages off and found a spurting femoral artery. At this point the patient passed out. Patient was sent to theaters for an emergency operation. Close call for sure. Bleeding a little. Young student from, I think, Pakistan. He was complaining about his neck feeling stiff. He went to a doctor some days before and he was told he was having joint pains that would pass with some common anti-inflammatory drugs. When I visited him I saw many of the lymph nodes in his neck were swollen, which probably caused the stiffness, and not painful, not a good sign. Sent him right away to have a chest x-ray that showed a huge mediastinical mass, suggestive of lymphoma. Sadly I don't know what happened to him. Once when I was a medical student on surgery rotation, in trauma, we had a patient come in after he fell on the street and bonked his head. Well, apparently he had fallen once earlier that day and was discharged when the trauma workup at the other hospital was negative for injuries. We examined him and noticed his eyes were kinda yellow. So as part of our trauma workup, given that he couldn't give a great story and we couldn't be sure what happened, we CT scanned his abdomen, and saw his common bile duct was like 3 times normal size, could drive a truck through it. About that time, next set of vitals his temp was 103 F. Guy was floridly septic from ascending cholangitis, which is why he was falling down. Big miss, and that is an emergency. I like how you used the word bonked. I hope it was the same language in his medical record. There was a story pretty recently in the hospital I work for, where a cardiologist in the ER was doing a rather difficult night shift, and started feeling lightheaded, dizzy and fatigued. Given how intense those shifts are, 26+ hours, sometimes multiple times a week, nobody thought much of it, and the doctor in question went to catch a quick nap in the staff room. People just passed by him in the staff room every once in a while, but they just assumed the poor guy was exhausted and let him rest. He was dead for several hours by the time someone realized something wasn't right. Not a doctor. We had someone at work die at her desk and it took almost 12 hours for someone to realize it. They thought she was sleeping and only realized something was wrong when they tried to wake her up at shift change.